Well, good evening, Indian Country. I'm David Kenoyer, and welcome to this town hall discussion. We can do this, Indian Country. The coronavirus pandemic is alive and unfortunately well. A lot of the headlines say that this isn't as bad as the Delta variant, but here's a headline tonight from the Washington Post. Literally, I'm looking at it on my computer. It's on their website, WashingtonPost.com. COVID deaths highest in a year as Omicron targets the unvaccinated and elderly. COVID deaths highest in a year. 900,000 official deaths and counting. 900,000 national deaths. So despite what we might read that the Omicron variant isn't as bad as the Delta variant was, there's still lots of people getting infected and unfortunately lots of deaths. This is part of the We Can Do This Indian Country campaign, sponsored by the U.S. Department of Health and Human Services and partners such as the Indian Health Service. I'm calling in from Minneapolis, Minnesota, and we have several guests tonight from the Southwest and the Central Plains, and we want to have a discussion about where do we stand in Indian Country with the pandemic more than 2 years into it. How do we have a civil conversation about this with our friends, family, who might think it's all fine, who might think, oh, I don't need that shot. I don't need that booster. My child doesn't need that booster. They might have lots of opinions, but how do we talk about some of the hard facts in the pandemic, even though we might be tired of talking about them? But for some people, 900,000 Americans, and that's just the official total, which a lot of people think is low. For 900,000 people, it was a matter of life or death. This is serious stuff, part of the We Can Do This Indian Country campaign. I work for G&G Advertising, which is an American Indian Alaska Native subcontractor on the campaign, and our partner for this town hall tonight is Native Roots Radio. And I just want to play a little bit of some of the messages that G&G has created to get people talking about We Can Do This Indian Country. And here's a short clip.
From Do you know I love you so, and mommy will never let you go. To the stars and the sky, you'll always be mommy's little guy. Hey oh, hey oh, hey oh.
Again, We Can Do This Indian Country, a campaign from the Department of Health and Human Services. And I want to bring in our first speaker tonight, Dr. Loretta Christensen, the Chief Medical Officer for the Navajo area of the Indian Health Service. And I know you were playing an active role at the national level, Dr. Christensen, who's joining us from Phoenix, Arizona. Dr. Christensen, how are you tonight?
Hi, David. I'm doing well, and thank you so much for having me tonight.
We read these stories, right? We've heard more and more politicians. I think the governor of New York was talking about eliminating a mask mandate today. More and more states and cities are doing that. And yet that headline that I just mentioned from the Washington Post, that we have as many deaths right now from the Omicron variant as we did last September from Delta. What's the status of the pandemic as you see it in Indian country?
Well, Omicron is still very, very real and still very active across the country. We certainly began preparing very, very early at the headquarters when we looked at the trends coming with the new variant and the way it's transmissible by breathing, coughing, talking, cheering at a ball game. It becomes a mist and it travels very far. So if you're in any kind of a small space or a crowded space, you're going to be very susceptible. So this was very worrisome to us. We know our American Indian, Alaska Native population has been extremely vulnerable throughout COVID. We've had 2.2 to 2.5 more cases than everyone else, over 3.3 more times more hospitalizations, and sometimes almost as high as 3 times more deaths. So we knew we had to be ready and we started preparing very well, telling everybody to mask up, watch their distance, wash their hands, and we will continue saying that until this pandemic is over with. So it's been very serious across Indian country. We've had a tremendous amount of cases. We have been what I call very hot, very high transmission in every single one of our areas in Indian country. So I think that we did well against hospitalizations and deaths because we were highly vaccinated, because people stepped up and got their vaccines, and many stepped up and got their boosters. Or I think we'd be telling a worse story than we're telling right now, but we're not done yet. I hope very much it's peaked. I believe it has, and we will slowly come down from this surge, but we're not down yet. So we have to continue to be very, very vigilant, very safe, and very careful.
I had made a couple trips to the Navajo Nation and Phoenix last year for other work, and on the reservation up at Navajo on the Nation, everyone was still masked up. Is that still the case? I mean, the mask, um, the people being concerned about the virus to the extent never really let up there. Is that still the case?
Absolutely, it is. And I have to give a big thank you to all our tribal leaders because they have really stayed the course. When everyone else was changing, when everyone else was going back to regular schedules, lives, events, a lot of our tribal leaders kept it nailed down. They said, you got to keep your masks on. We're not going to have these indoor events. We're going to be very careful how we gather, for ceremonies, for events, for celebrations. And I'm so happy they did that because they kept a lot of people very, very safe. Right now, masks are it to me. The masks are so vitally important.
And so many of the folks who are being hit hardest by the Omicron variant are the elderly, our seniors, our elders, correct?
That's always gonna be true because they are just more vulnerable by virtue of being an elder. They do have more chronic problems, of course, and we worry about them all the time. But I think the good news is that one of our highest percentage of vaccination is in those age groups above 65. So we have done a very good job of protecting our elders, but we will always worry about them till they're not at risk anymore, which is when this pandemic begins to really dissipate.
Dr. Christensen, what about for children? That's been the new development, right, in the last couple months. The Pfizer BioNTech vaccine made available to children 5 and older, going on a good 2 months, I think. And then now Pfizer being asked to turn in data for test results on 2 doses with children as young as 6 months. And so if that receives authorization, uh, toddlers, 3 or 4 year olds would be also eligible. What's the vaccine uptake been like, as you can see in your neck of the woods and maybe even nationally?
Well, this has been such a long journey since we first started vaccinating, and we waited with great anticipation for each age group to roll out, and we're finally getting there. We have to remember to really get community immunity or herd immunity. That means everyone in that population needs to be vaccinated. So we've done very well. We are wanting to do better with our 5 through 12. We need to hit that harder. We also are concerned about the other childhood vaccinations, so we're trying to combine those with well child visits. Every time someone visits their doc or their pediatrician, we're trying to get all their vaccinations done. And now with the impending possible approval of the 6 month through 4 years, we are already preparing. We already have estimates of our population. We're already pre-ordering in hopes that this will get approved. But we have a lot of work to do. We've done great. Don't get me wrong. I'm very proud of our American Indian Alaska Native people, but we have more work to do, which is to make our kids safe. We want them in school. We want them in their sporting events. And to do that safely, we have to vaccinate them because we do not want them to miss out on school, those social events, those things that help them mature and grow. So the caveat to that is let's get them vaccinated. Let's get them safe. Let's give them their masks. Let's get them back to school, sports, etc. So we have some work to do still.
And nationally in January, there were what an average of more than 550,000 COVID cases per week among children. So children are susceptible to the virus just as much as anybody else. What's the difference though in the doses, right, from what you and I received in adults? What are kids getting, 5 and up, and maybe even these younger ones now who are going to soon be eligible?
Well, the vaccinations for the age groups were developed for age. It wasn't a weight based or anything that we do some other medications on. So a lot of the clinical studies that were done by Pfizer, because that who covers us on the 5 through 12, and of course the 12 through 17, and they're the ones submitting the data for the 6 month to 4 year old. So they based it upon their studies, their clinical responses, and adjusted the doses to be sufficient to provide immunity, but not too strong for those of those age groups. So it will be an entirely different dosing. It is going to be in different vials, safety measures, everything put in place to make sure that it is administered correctly. And you should really stick to the age groups and give the vaccination doses that have been specified for each of those age groups. So it will always be slightly different. Kids are in development. They are generally not, smaller in those age groups. And what they did is they focused on age. And that has actually made it good for us because we can keep it very, very clear who gets what vaccine. So I think we've done a really good job with that.
You said, doctor, the need to hit the 5 to 12 a little harder, um, and you're trying to combine those vaccinations of the COVID, Pfizer and Moderna vaccines. Well, Pfizer just for the kids, right?
Mhm.
With other, if they go to the doctor for something else, hey, you're here. Why don't you get this shot too? What are some of the concerns that you've been hearing from parents? What questions do parents, families typically have, caregivers?
Well, I think there's been a few different questions. One of them is parents were willing to step up for themselves. They felt strong, they felt, mature. And then they look at the fact that these vaccines are fairly new, but they also have to remember, and what I really encourage people to consider is these have been extraordinarily effective vaccines. The fact that they were developed so fast and they are so protective against all of these variants. I mean, we've been through a bunch that they are well developed, they are very efficacious, and they're very, very good at providing safety. And we have to convince them that goes down through all the age groups. They're like, I don't want to give my child something that's not been around very long. I don't want them to get all those shots at one time, which you don't have to. We do encourage that because we have you right in front of us and we want to make sure you're safe against the flu and all the other vaccinations that children need, but you could space it out if that's a concern. We'd really encourage people to let their kids have these COVID vaccines because we know, one, we don't want the child to be sick. There's over 8,000 cases of what we call MISC, which is a multisystemic inflammatory syndrome that kids get that's very significant. It creates inflammation throughout all the organs in the body, and yes, they can die from it. And so it is a very, very um, bad disease process that we'd like to avoid in these age groups so they can get that. Secondly, they can pass it to their elders. We have families that are multi-generational, all living in the space. And if the kids are not very sick, but they bring it home or they have it, then our elders are very vulnerable and at risk again to get transmission of COVID. So it protects our families. And then most of all, we want them to be healthy, as I said, and get out to school and get back to kids' activities, which they desperately need. This COVID has been pandemic has been so hard on our kids. So there's several excellent reasons to do it. And we can definitely go over that with parents and answer their questions. And we welcome their questions so that we can make them feel safe with giving these vaccines to their children.
Tell me more about MISC. Is that sort of one of the susceptible side effect type diseases that can happen because of this? So like similar to long COVID that they're talking about with adults, or what is MISC?
Well, it's a syndrome that children that was identified fairly early in the COVID pandemic. Kids would get COVID and it would proceed to this MISC, which is the multi-system inflammatory syndrome, which means that they are just overwhelmed with inflammation. And I mean around the heart, around the lungs, around the GI tract, skin, eyes. These kids get very, very ill and they can have long-term neurological issues from it and they could be very critically ill. Now, not a large percentage of kids get it, but it is real and it is out there. And we don't want our kids sick at all, and we certainly don't want them sick with this syndrome.
There's a lot we don't know about what this virus can do, right, to our bodies, and everybody's different, right, to some extent, based on your. I mean, who knows, right? Because there have been perfectly healthy folks that have gotten very, very sick, if not died, and there have been older folks who've been hospitalized or infected who've made it through, right? So what do we not know about COVID that is because I've heard some people. I got vaccinated because I didn't want long COVID if that was going to happen, right? This maybe long term feeling that you're not yourself and if you may not even be able to work.
Well, long COVID is very real, and I'm very happy that you brought that up because that is something people should begin learning about, if not already, is that a great percentage of those who never were in the hospital, up to 35%, can have long COVID symptoms. That's over a third.
Mm.
And then when you look at those hospitalized, it's been predicted as high as 80% of those that were critically ill or hospitalized will have post COVID or long COVID. Just think about that in our population that's already vulnerable, who has also always been hit harder. And I think we're going to have, unfortunately, a lot of cases of long COVID. So we want to be prepared to address that in all of our healthcare communities. And we've been talking about this for some time and working on resourcing and protocols and things that will help us to battle the long COVID. But you're completely right. We don't want to get COVID. Some of us will, but we don't want to get it. We'd like to avoid it because we don't know how each body is going to react to the virus. And that's the same with the flu on a different level, of course, is why do some people never get the flu? Why do some people get the flu almost every year? And why do some people die from the flu? Because it's the way our body fights, our immunity fights the virus. And since COVID has been so challenging and has mutated and has been different variants, we don't know what we're fighting a lot of the time. And the body has not seen COVID before. So there's not that natural immunity that we have seen in other diseases that we fight. We don't have it yet. I hope we will, and I hope it will become an entity that doesn't do this to our populations. But again, we're not there yet. We're still fighting active COVID. So I would not take the chance, David. I just would not take the chance. You want to stay well. You want to get your vaccines up to date with your boosters. You want to wear your mask, wash your hands, and watch your distance, and still be careful where you are. Try to keep yourself safe.
So you're not running. You don't have tickets to the Super Bowl this weekend over in LA. I'm guessing, Dr. Christensen.
No, I don't. And I do love sporting events. But I have been kind of encouraging people don't travel unless you have to. Every way you travel, train, bus, airplane is a tight space. very close to people you don't know. You don't know if they're vaccinated or boosted. You know, you keep your mask on, but we don't know if everybody there keeps their mask on. And it is just, we're just in a fight with Omicron right now, which is so highly transmissible that you need to take very, very good care of yourself.
And not wanting to take a risk and not knowing how my body's going to react and my immune system versus someone else's immune system. What explains the the fact that some people who've been received their vaccinations and boosted, I had two Moderna last year and a booster toward the end of last year, and people like me that I know have been infected with COVID, or at least their home test showed that they were positive, right? That's happened, right? Yes, with some people.
Absolutely. And unfortunately, with any vaccine, there will be breakthrough because as highly effective as these vaccines are, and they are, a certain percentage will still get COVID. And that is just a statistical improbability that it's going to be 100% perfect. But it's very high and it protects the great percentage of people. We are seeing a little bit more breakthrough right now, and I do believe that's due to the high transmissibility of Omicron. It just spreads so easily. There is a new subvariant, which we call BA.2, that is about 1.5 times more transmissible than our current Omicron, which is BA.1. So we're still, that's why we're still encouraging the masks and the good masks. And if you don't have a good mask, wear two masks and just be very careful because it's still transmitting. So that's my best advice is to just take care of yourself a while longer. I know everybody has COVID fatigue. Everybody's tired of this. We just want it to be over with, but we have to keep fighting.
Well, I think I read earlier today that about 75% of the country has been vaccinated. And if we can work on these children, like you said, the 5 and up that are currently eligible for Pfizer, and the 6 month and up that will be eligible for Pfizer if all of the authorizations happen. What is your thought of when we might be able to not be so vigilant with a mask, or is that just going to be the way it is for the foreseeable future, the rest of 2022 into 2023?
Well, we're actually really hoping that we're going to convert from this pandemic status to endemic, which means like the flu, we know it's still there. We still know we're going to get it, but we have effective vaccination against it so that we can protect ourselves through those vaccinations without always being in this public health emergency crisis. Our numbers are too big right now, but I think if we can get through this Omicron surge, then we'll start heading that way. And we have to then begin to adjust our responses to a response we can maintain. If you look at the fatigue of the healthcare workers, they are they are vaccinating, they are testing, they are taking care of patients, sometimes 7 days a week. Cannot thank them enough. Absolutely the most wonderful teams that there are. But we can't keep sustaining this. So we have to do the things to help our public health response, which is to get vaccinated, which is to get boosted, to keep up to date, get our kids, every age group done, so that we have as much immunity out in our communities as we can. Then we can begin to convert to an endemic management where it's something what we know we're facing. We can control that response. We can keep people vaccinated like we did with so many diseases over time, which don't make us ill hardly ever anymore, which is what I hope will happen to COVID. So it's a lot of work and we're not there, but that's what we're working towards. But you have to do all those pieces. You can't, healthcare teams just cannot continue to support at this level. So they need our help. They need our help to encourage people to get vaccinated, get their boosters, and do the safe things for now. That's how we support our healthcare teams across the country.
So, am I also hearing that maybe in the next couple, 3, 4 years, that'll kind of be like the flu? We just might have to have a different type of shot every year.
Well, that's a possibility, David. We don't know yet for the study. They're gonna do the studies and see how long the immunity can be. It may be if we still get, how we have different types of flus, and we try to give the best vaccine we can every year. We hit a lot of them, but we don't hit all of them. I suspect COVID will be similar to that, where we have to have a vaccination and it will be adjusted to what's going on across the country in the future. That would be the hope because that's manageable.
Right. What would you advise someone like, me or some of our listeners, once someone sits down with someone like you, Dr. Christensen, you're like, "Oh my gosh, she's so smart and she's so calm and I really like her and I could have some coffee and cake with her." But actually getting people to sit down and talk and listen to each other is sometimes the hard part, right? How do we even start, a conversation? I've got some relatives who still aren't vaccinated. I think they've all had COVID, not seriously, but how do I even talk to these folks without avoiding the question, right? And kind of avoiding the fight?
Well, that's a great question, and that has been our challenge across even Indian country, where we really stepped up very early. And I know that saved a lot of lives because we were high in our immunizations before Delta, and we weathered that. And we're still getting through Omicron, although I would love the numbers to go down even more. I think it's the conversation of listening, trying to hear why people are not wanting to get the vaccination, and then trying to address those in a non-confrontational, non-adversarial way. Like you said, have a conversation. This is why I think you should get this. They say, well, this is why I don't trust it or believe it. We try to explain what that means, and then we try to really be very honest about what could happen. And as you said, over 98% of the cases that are critical, hospitalized are unvaccinated. That's very telling just right there. And you're going to look at this. The group that we have the most challenge with is our young, very healthy, very smart adults, and they're very strong. And it's hard to convince them they could get very ill. But we've lost a lot of them to COVID because what you said, you don't know which person it's going to affect severely. And we do have some new antivirals that are coming out. We don't have enough of them yet. I think, maybe that'll be something that we have to take on as that comes, as the supply increases. And that may even challenge us more to try to get people vaccinated because they could say, I want to take the meds. Well, yes, the meds will help you, and I'm glad to have them. But your best protection, your best weapon, your best tool is your vaccination and your booster.
Didn't I hear that the meds for Omicron aren't as effective, and they're at one point weren't even holding back on some of what the monoclonal antibodies, or maybe you could set the record straight there.
Sure. Of the monoclonal antibodies, we know that the bamlanivimab and then the Regen-CoV-2 were excellent against Delta. Unfortunately, they weren't as effective against Omicron, and the emergency use authorization is on hold for them. So the one that we have is sotrovimab, and that is actually very, very effective against Omicron. Our only challenge with that is we need more produced. The allocation is just not large right now, but what we've gotten, we've used very wisely and very well across Indian country. We have well over 100 infusion sites. Some of them were done in partnership with states. Some of them were done in partnership with hospitals and facilities in an area. Excellent job across Indian country. They got these things together. They have infusion clinics, and we are giving the medications, and they are helping. The oral antivirals, which are molnupiravir and Paxlovid, again, very effective if taken within 5 days of the symptoms, 5-day course. We're just waiting for increased production, which we expect soon. The manufacturers have really ramped up. We hope to get a lot more out there, and that keeps a lot of people out of the hospital and keeps them from getting significant disease. So we're very lucky to have these tools.
Well, thank you for explaining them. We've all kind of been trained as American health consumers that a pill's going to solve all our problems. So Thank you for saying we should still get a shot and not count
Yeah.
on this medicine that A, may not be available, or B, may not even work as well.
Yes.
Uh,
Absolutely.
Before I let you go, let's just hit the high points again with where the vaccine stands for young children, and how soon you think your best thinking is that the Pfizer vaccine might be available.
Well, to the best of our knowledge at this point, a lot of the research has been submitted and is being reviewed, which does take some time. The fact that we are pre-planning and that we already are getting our pre-orders ready gives me hope and confidence that within the next 1 to 2 weeks, we may get a final decision from the FDA and then ACEP, the committee of the CDC, and then final approval by the CDC. So we are ready to go. We are teaching, we are educating, we're putting out our safety information to all the facilities. We know how much we're getting in the first allotment, and then we know we'll get more as we go, and we've estimated our populations. So again, my thanks to our wonderful vaccine task force because they have prepared all of this ahead of time.
Hmm.
So we feel fairly confident it's coming very soon, David, and that's good news for us that we can then get that last age group started with their vaccinations against COVID.
Well, that's awesome, and I just want to thank you for all your not only for joining us tonight, but you and your colleagues. From the beginning, the Indian Health Service was really on top of things, and I think it made a lot of us proud. And it wouldn't have happened, right, without the task force and without areas and without a lot of doctors, nurses, and health providers. So thank you for your leadership, and thank you for being with us tonight. And I hope we can visit with even happier news maybe in a few months.
Yes, thank you so much, and it's been my pleasure. Thank you.
Thank you, Dr. Christensen. Have a good night. We appreciate you joining us. Stay safe. The headquarters Indian Health Service Chief Medical Officer, Dr. Loretta Christensen, Navajo. It looks like you have a book or two waiting for you there behind you, Dr. Christensen, in your spare time. Wow, busy, busy, busy. This is We Can Do This Indian Country, a town hall conversation, and Dr. Loretta Christensen was just a wonderful source of information. There's more information online. If you've got specific questions about the COVID-19 vaccines, go to vaccines.gov, and more information at wecandothis.hhs.gov. Wecandothis.hhs.gov. There have been a number of messages targeted toward American Indians and Alaska Natives in the United States and beyond, trying to start this conversation, right? There's no simple message that's going to work for everyone, but how do we talk to folks who are on the fence, who still have questions, who think that they're well enough that they can, even if they get infected, that they'll be fine? How do we help folks really, really educate themselves and answer their own questions, right, with people they trust, with information, and with conversation and examples like we're sharing tonight? But I wanted to play another spot from the We Can Do This Indian Country campaign produced by G&G Advertising, a Native American agency based in Oregon and Montana. And let's hear one of the two new radio spots that have to do with getting our youngsters and little ones safe.
Sweet dreams, my baby. There we go. All snug, sweetheart. Have a great day. Oh, wait. Don't forget your basketball.
Thanks, Moon.
You cradled them. You buckled them. Now it's time to get them vaccinated. COVID-19 vaccines are highly effective in preventing hospitalization and death, even against the Delta variant. It's more important than ever before to protect yourself, our communities, and all our loved ones. We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
a message from We Can Do This Indian Country. We Can Do This Indian Country. And you can find more resources online at wecandothis.hhs.gov. There have been some social media spots, radio, and some video spot. Again, it's about starting a conversation, talking to people, listening, seeing where they're at, and guiding them to a resource where they can find more information and make a decision on their own, right? Make a decision on their own. Thanks for joining us tonight. I'm David Kenoyer. I'm a member of the Rosebud Sioux tribe, and I've got Kenoyer relatives on the Yankton Reservation, and we were talking earlier, lots of relatives spread out far and wide. I want to bring in our next speaker, who's dialing in from the central part of the country, and Kevin Aberesk is also got some ties to South Dakota, I believe. Kevin, thanks for joining us, journalist with Indians.com. I know Aberesk is a former senator from South Dakota, so what's it like having that name your whole life? Kenoyer's, butchered all the time, Conver and corn what, and so Aberesk is maybe even more challenging.
Yeah, I can't tell you how many different variations of Aberesk I've heard in my lifetime, and how many different consonants people add to it whenever they pronounce it. So thank you for pronouncing it correctly. It's pretty amazing. You can tell whenever I meet a South Dakotan when they pronounce my last name correctly. So, but yeah, that's one of the reasons I moved away from South Dakota, honestly, is to kind of get out of the shadow of that name a little bit. So kind of make my own way in the world. So I'm broadcasting tonight from Lincoln, Nebraska. This is where I've lived since about 1999. I've been a journalist here this whole time, reporter, editor for the local newspaper. Last 4 years I've spent with Indians.com. This is a Native American news website owned and operated by the Winnebago tribe of Nebraska. And just an incredible opportunity for me to do this kind of work. And I want to thank you for having me tonight.
Well, no, thank you for making time for us. What have you been observing with the state of the pandemic in Indian country and around you and your coverage? Where do things stand as you see it?
Sure. In addition to serving as managing editor for Indians.com, I serve on the board for the Lincoln Indian Center here in our community of Lincoln. And this is our primary Native American community center. And we work with a number of local organizations as well that work with Native people and others. I can tell you that since the start of this pandemic, we've seen a pretty incredible community response here in Lincoln, and our local health department's been very successful at getting people vaccinated, and our local tribal organizations, including the Nebraska Urban Indian Health Coalition, the Ponca Tribe of Nebraska, which has a service center here as well as a clinic now. They all offer tests and vaccines. They've been incredibly adept at providing these services to Native people here in Lincoln. But that said, I mean, there's still been a lot of hesitancy by some in our community, especially some of our elders, I would say. I don't know if it's because of lack of education or political views, or perhaps just a general mistrust of Western medicine. Many of our elders here are very traditional, and they practice traditional spirituality, and many prefer to rely on those practices rather than accept the help of healers practicing Western medicine. As a result of that, we've lost a number of elders in our community. And, the Lincoln Indian Center serves as really the primary site for Native funerals here in Lincoln. And I'm really sad to say that we've been really busy most weekends over the last year, especially with funerals. And so it's really unfortunate. It does seem like in Nebraska, though, the rate of vaccinations has been very successful, very high. Winnebago, Omaha, Santee reservations have certainly had very high vaccination rates. For example, in Winnebago, the vaccination rate is about 71% for those age 5 and older, compared to about 66% for people in Lincoln. And so I think that's certainly a success. In addition to severe illness and death, our community has experienced job losses and financial hardships. And our children are struggling as well, especially trying to succeed in school. A lot of them spent almost a year in virtual school and, had to try to come back and reintegrate into in-person school. And a lot of them kind of fail to do that, I would say. It's really unfortunate. We've seen some increases in domestic violence as well, as a lot of people are at home and under a lot of stress. And we've seen a lot of our community dealing with things like food security and mental health issues. And we just don't have enough behavioral health services for them. But that said, it does seem like our younger Native population here in Lincoln does seem very willing to take the vaccine and ensure that their children also are vaccinated. In Lincoln, we make up about 0.4% of the population, but we make up 0.6% of the total vaccinated population. So that shows that we're higher than average when it comes to getting vaccinated. But that, I would say was mostly from our younger Native population here.
Wow, thank you for that picture. Lincoln is a college town. You've got the University of Nebraska there, and it was great to hear that the Ponca tribe has opened a urban center there, which is not common right in South Dakota where we're from, and more common in Minnesota where I live, where several of the Ojibwe and Wisconsin tribes have a presence in the Twin Cities. So it's interesting that the access rate is there for Native people if they need multiple places, if they don't want to go to their county or private clinic. Who knows what the tribe could provide for enrolled members, probably, or descendants. And it's interesting, in a college town, you're probably going to have a little more progressive type liberal thinking as opposed to maybe outstate. But what have you seen with mask mandates? And when you go to the store, are people wearing masks? And does it differ between natives and non-natives, or do you see any patterns there?
Sure. Really since the beginning of this whole pandemic, Lincoln has instituted really broad public health measures, starting with, of course, total lockdowns in the spring of 2020 and the shutdown of our schools, followed with really more relaxed measures as these various coronavirus surges have ebbed and flowed. Lincoln was one of the cities in Nebraska most affected by the virus, behind communities with large meatpacking plants like Crete and Hastings and those kinds of communities. Since the start of this pandemic, we've seen about 68,000 cases of coronavirus in Lincoln and about 400 deaths. Our COVID risk dial currently is in the red, and that means, of course, there's a strong risk of viral spread. Our most recent mask mandate began January 15th and was actually scheduled to end February 11th, but was just extended today until February 25th. When I'm walking around in the community, I would say that it does seem like it depends on where you go, right? It's there's certain stores, I would say outdoor stores, Shields, things like that, where not a lot of people are wearing masks. My son plays basketball, and very few people in the audience are wearing masks, and very few players are wearing masks. My son and I actually just got over COVID about 3 weeks ago now. And it was just the two of us that caught it. I'm pretty sure he got it from playing basketball, and I probably caught it just from hanging out with him and spending time with him. So, but luckily it was very mild for both of us. So.
Had you been boosted, Kevin?
Yes, vaccinated, boosted, very recently actually. About a month before I caught it, I was boosted. My son had reached about the 6-month mark. We were actually scheduled to get him boosted 2 days after he was diagnosed. So bad timing there, but obviously vaccinated people can still catch it, but I think for us, at least, the difference was that he had very, very mild symptoms. I might not have even gotten tested if he hadn't tested positive.
Right. What were your symptoms, like a cold or?
Yeah, if even that. Really very tired in the evenings, come about 8 o'clock or so, just had a hard time staying awake. And I'm kind of a night owl, so that was very strange for me. But other than that, maybe a mild cough, a headache, and just maybe for one day, I think I had a headache, but wasn't terrible. And that was about it.
Well, good. And your son too, he wasn't that sick?
More than me, certainly. Yeah, he had a pretty bad cough for a couple days, but nothing alarming, I guess.
What position does he play on basketball?
He plays weak forward.
So is he a
Yeah.
shooter or is he?
Yeah, he's a shooter.
Yeah, I guess everybody is these days.
Yeah,
The game changed so much. I grew up. I wasn't very good myself, but I grew up refereeing, and that was one. That's how I earned my uh, gas money in college, was refereeing. JV games and then a couple high school varsity games every once in a while, and we didn't have the 3-point line then. And then a couple years ago, I gave it another shot. I don't know what I was thinking, because as 25 years later, you can't keep up with those 14, 15, 16, 17-year olds like you used to. And the game is just so different with that 3-point line. It's interesting.
absolutely. Yeah, it's certainly changed, even in the time that I've been watching my son play for the past decade or so.
What do you think? So it sounds like the Lincoln Indian Center there has been open for the most part. Is that true?
It has been, but we had to shut down, most of our public events for about maybe good to 6 or 8 months there, when that surge really hit us back in 2020, and we couldn't even allow funerals there, which was really sad, of course, because our Native people still needed a place to say goodbye to their loved ones, and we just couldn't offer that without risking our community. But we've started to allow that again today. We have instituted a lot of different public health requirements within our facility. Of course, masks and social distancing and those kinds of things as well. So I think that's helped, but yeah, it's been tough. It really affected us in a lot of different ways. We made a lot of our revenue from parking cars and Indian taco sales and things like that. And we just weren't able to do those things, obviously, during the height of the pandemic.
Sure. Yeah, the Minneapolis Indian Center here too was closed for a long time, and I still don't know if they're allowing large group activities in there. But Minneapolis has had more pretty stringent restrictions as a city, which it sounds like Lincoln has too. But I know they've had to turn down funerals, as well here, and a lot of people, right, just had very small events, right, for their own family. It's kind of ebbed and flowed, and where you can do it outside or what have you. So it's been very difficult to grieve, right?
Yeah.
How do you see this playing out over the long term? I mean, you've got, sounds like more than one kid, and kids probably help weather the storm to some extent, because but where do you see this going? And talking to tribal leaders here and there, and keeping an eye on the national, how does Indian country continue to go through this? Because we heard Dr. Christensen earlier talk about how many tribes have just stayed red alert right from the beginning.
Yeah.
What do you think's how going to play out?
I think it's just going to become part of our lives for the long haul. I think it's really unfortunate to have to say that. We'll have to continue I'm sure we'll continue to see variants that will require regular tweaks to our vaccines, and we'll become accustomed to these surges and all the necessary public health restrictions that come along with them, including mask mandates and potential lockdowns. My greatest fear is for the long-term impact of coronavirus and public health restrictions on our children. I have 5 children here, and my youngest child has already spent a fourth of her life, under this really dark cloud of coronavirus, and I worry how that's going to affect her emotional and mental health in the months and years to come.
Well, I hope you can find time to write about that, and I totally agree with you. My kids are older now, and my younger of the two graduated high school in 2020, all virtual, right? A virtual ceremony, and nothing in person. Her school wouldn't even do something on the football field, as a lot of schools were at the time. But no, it was all virtual. And her sister graduated from college, same thing, all virtual classes her senior year of college, right? I mean, that's supposed to be a happy time, and saying goodbye to your friends and having some fun, right? And as you're pushing off adulting as long as you can, right? But all virtual. And I totally agree with you that this is still the untold or less told story of the pandemic, is the mental health impact on kids and many other people stuck at home, didn't have a chance to grieve, uh, patterns of socialization changed, a lot of cultural events impacted. Um, and it's just a shame that we haven't used that, at least with kids in schools, I believe, right, as a real opportunity to rethink, yeah, a lot of how we think of school and how we think of learning, yeah, and change it up,
Mhm.
because it wasn't really working for a lot of kids before COVID.
Yeah.
And then you want them then to learn in front of a computer all day.
Mhm.
Not going to happen with a lot of kids.
No, absolutely.
You've got 5 in school then?
I do. Yeah. And I'm married to a third grade teacher here. And, I just hear every single day from her, even just how difficult this has all been for children, and all of the behavior problems that she sees in her classroom, and how difficult it's become to teach, really, when you have to balance all of these requirements to keep students stay safe, and keep yourself safe, and sometimes teach children virtually. And it's just really a lot right now.
Oh,
Mhm.
kudos to her and to you
Yeah.
for supporting her. And that age, right? 3-year-olds learning online? No, right? No, no. Much less 30-year-olds. It's hard,
Yeah.
Um, my older daughter started a job after she graduated, trying to just get through things and wait for things to reset, and it's all online, this job, right? Can you imagine, like, starting out being a reporter, trying to do everything online, when we're 22, 23, nothing to ground you, nothing to
Mhm.
grab onto, and kind of like, really watch and learn and observe and kind of watch the room, and don't know your boss, don't know your expectations. It's just got to be stressful as heck.
Yes. Oh, I'm sure it is. Yeah.
Tell us more about Indians.com.
Hmm.
As I recall, as one of the first online sources of information in Indian country.
Yeah.
And where does Indians.com stand these days?
Yeah. We were established in about 1999. And, we essentially have 4 staff members. So we're very, very skeleton staff, I guess. But my editor, AC Agoyo, is based in Washington, D.C., and is our primary political reporter, and covers most of the, Bureau of Indian Affairs events, Supreme Court cases affecting Indian country, of course, anything going on Capitol Hill. And then I cover most of the Midwest, Great Plains. I travel too as well, but certainly since the start of the pandemic, I've traveled a lot less. And that's really because I can't imagine getting on an airplane, and haven't gotten on an airplane since this all began. But I'll drive places still, but mostly within the Great Plains. So. But we have another journalist who works in Oklahoma, and another one who works on the West Coast as well, covering stories for us and feeding us content from there as well. So we're pretty dispersed.
Yeah. What are you seeing? Um, does it vary? On your travels. I mean, are all the reservations pretty masked up, or does it just vary? Depending on where you're at, and maybe what the neighboring border towns practices. What's it look like in your travels there and about Nebraska and beyond?
Sure. Yeah. In South Dakota and Iowa and Kansas, I mean, everything I've seen is Native communities are taking this very seriously compared to the larger, mainstream culture. And I'd attribute that to our values, to our respect that we have for our elders, and respect that we have for Mother Nature, and the humility that so many of us have, and really trying to respect these various restrictions that we have to endure right now. So most places I go, if I walk into a Walmart in Rapid City, I'm going to see a lot of Native people wearing masks and a lot of non-Native people not wearing masks. I mean, that's just the rule of thumb, whenever I especially venture into those kinds of communities. And I'm proud of that. I'm very proud of that, and I'm proud to be one of the people wearing masks and modeling that behavior for other Native people, for my family, for my children. We're used to kind of sticking out anyway, anywhere we go. So wearing a mask isn't that much of a stretch anyway. But it's something that I'm really proud of our community for taking up this cause. So.
Well, you're a better looking guy, so I wear a mask, to cover this face, face made for radio. And you, on the other hand, you got to show off that good looking newspaper face, Kevin. Anything you want to add before we say goodbye?
No, just thank you so much for having me on here. And I would say that not everything that's come out of this has been negative. I do think that COVID-19 created a renewed focus on the health and social challenges facing our Indigenous communities. And I'm really proud of that. I hope that becomes really a clarion call for federal leaders, especially, to do what they can to improve federal programs and policies for Native people. We saw how devastating this was to us. And a lot of that was because of, the various health and social disparities we've had to endure for generations. So hopefully that continues.
Yeah, I agree. I mean, it's been pretty bad, but we haven't seen this sort of infusion of resources and attention on Indian country it probably ever in my lifetime, right? In the last 2-3 years.
Absolutely.
Very impressive, and a great opportunity to think differently about public health and wellness, right? And the answer isn't always in a pill, right? So how do we change behavior? How do we, like we were talking about the Indian centers, right? Here in Minneapolis, the Indian Center instituted 2 things, right? No smoking, got to smoke. Everyone's kind of done that. Smoke off, off the property, but also a healthy drink policy, right? And you were talking about, fundraising by parking cars and selling Indian tacos. Well, selling soft drinks at these events too can be a big moneymaker. And the Indian Center in Minneapolis said, no, we're not going to do that anymore because these drinks are killing us in some ways, right? All the sugar. What other opportunities, before I let you go? How do we, we could have reset school in some ways. How can we reset or rethink the conversation about health and wellness?
Absolutely. Yeah. I think that the fact that we've all had to become very adept at using tools like Zoom and live stream, StreamYard, I guess, is what we're using tonight. But these kinds of tools can really help us in the future, protect each other whenever these surges hit again. One of the things we're doing at the Lincoln Indian Center is we're developing a health information network, a communication network, really, so that the next time we endure another pandemic or another surge, serious surge, we'll know how to reach our community more effectively, whether it's through phone or email or Facebook Messenger, honestly, has really been a powerful tool for us. Mm-hmm. And Facebook in general has just been incredibly effective tool at reaching our Native community here. But just trying to find people where they're at, if they lack a computer or the internet, reaching them through other means. So we're doing a large survey, trying to really assess the best way to reach our Native community.
Where do you think that's going to end up? More Facebook or texting or what?
I'd say more social media. I just think that it's such a powerful tool for us in so many ways. I'm finding that just in my work here at Indians.com, that social media is just going bonkers. I don't know how else to put it. I mean, it's, these TikTok videos and things like that get such incredible hits, and Instagram, and Facebook. I mean, I'll post a video on YouTube and get a fraction of the hits that I'll get, on a live stream like this or a live stream on Facebook. So,
and can we find you on TikTok? Are you dancing on TikTok?
Not yet. My editor's really trying to get me into it. I'm a little bit reluctant to do it, but I'll get there. I will.
Come on, Dad. Right there. Your kids are like, "Don't, Dad, don't do it. Don't do it." Well, Kevin, thank you so much for your time tonight and your reflections. And please give our thanks to your partner, a third grade teacher. That's the true front lines, right, for all of this. And thank her for us, and thank your kids for sharing you tonight. And I hope you haven't missed dinner.
I haven't. Thank you, David. Great to be here.
Stay safe. Thanks,
You as
Kevin.
well.
This is We Can Do This in Indian Country, a conversation with Kevin Aberesk of Indians.com, Dr. Loretta Christensen, the Chief Medical Officer for the Indian Health Service, just bringing you more information and what's going on with the COVID-19 pandemic in Indian Country. This is part of the We Can Do This Indian Country campaign for the Department of Health and Human Services, and with partners like the Indian Health Service, with the Lincoln Indian Center. We would love to partner with you. I know we've talked to the National Urban Indian Family Coalition, that is the umbrella and kind of a network for these different Indian centers, to try to get good information in front of people so that they can make good decisions, right? It's hard to find good information, right? You have to either pay for it sometimes online, or really sift through what you see on social media to see what's the source, and does the source have a bit of bias or kind of spinning, right? Is it spinning it? So We Can Do This Indian Country, trying to get you and all of us, our families, our relatives, to talk about the facts, talk about the real experiences and examples. There's more information at wecandothis.hhs.gov and vaccines.gov, vaccines.gov. As part of that campaign, I want to play one more spot now that the Pfizer BioNTech vaccine is available for children 5 and up, and may soon be available to children from 6 months and up. Here's a clip from the We Can Do This Indian Country campaign.
Do you know I love you so, and mommy will never let you go. To the stars and the sky, you'll always be mommy's little guy. Hey oh, hey oh, hey oh.
Awesome. Those pictures are beautiful too. Not only the people, but the surroundings. We're waiting for winter here in Minnesota to end. It's not been a bad winter, but today we hit 40 and it felt, oh my gosh, right? Things were melting for the first time since, I don't know, somewhere back in December maybe. But we're waiting for spring, waiting for summer. Speaking of the start of winter, we had a conversation in December with Adrian Laverdure, a medical doctor from Turtle Mountain, the Turtle Mountain Ojibwe reservation in central North Dakota. But Adrian has worked much of her career in northern Wisconsin on the Bad River Reservation, which is not too far east of Ashland, Wisconsin, up toward Lake Superior. Beautiful, beautiful part of the country, truly Indian country. Trees, dense forests, streams, snow, right? You think of forests and snow and winter, and you could picture Bad River. And Dr. Laverdure shared her experience as a family physician in a tribal setting. And at the time we talked to her, the Omicron variant surge was just starting. And it really was taking her back as a medical provider, as a health practitioner, to the whole start of the pandemic in early 2020, right? When we didn't know so much about how the virus spread, how to protect ourselves. There was no vaccine on the horizon at that point. Remember, we were starting to mask up. We were washing our hands constantly. We didn't know exactly how the virus spread, right? We weren't necessarily taking our groceries into the house without cleaning them or leaving them outside for a day or two or three. So there was just a lot of unknowns, right? That was very, very scary at the time. And Dr. Lavender walked us through some of those feelings that she had then, and then now with the Omicron surge that when we talked to her a few weeks ago was just starting. So let's listen to these reflections from Dr. Lavender and some of the really, really challenging conditions that our Native American and non-Native allies in these clinics are going through.
When I first started this and I was at the hospital helping, it was not, I couldn't even explain it. It was like I felt like I was in some kind of movie. It was the strangest thing. Working probably, I mean, it was like 16-hour days, and I would come home. I would have to take all my stuff off. I would jump in the shower, terrified of getting your family members sick, but just super overwhelming at that point. And watching people pass away from it was probably one of the hardest things. And having to be alone, it was so hard not to be able to let people come in, and then we tried to use Facebook. But again, all these people, most of them were on vents that were passing away. And, keeping our gear on for that whole time. And I mean, you wouldn't even eat, you wouldn't even drink, because the thought of like taking your gear off and putting something in your mouth was like almost terrifying a little bit. So not only were you working long days, but really not taking care of yourself. And then by the time you had a day off, all you did was sleep. And then by the time it was time to go back to the hospital, you were just now recovering. And so, being here in the clinic, it's not as tough as that, but I don't think I could do it right now because so many of the people that are passing away are more younger people. Either way, it's hard. So you have people that are burnt out. You have people that are retiring early. One thing that really works with the students, especially the high school students, let me tell you, the biggest thing they learned and the biggest thing when talking to them, how much they miss their friends. How much they miss their friends and being at school and, the education and the teachers. And so them being at home, out of school and on, like, computers. So the biggest way I would reach them is say, you know what? You get this vaccine, you're going to go back to school. Mm-hmm. So you have a choice. Don't do the vaccine. You guys are going to be home with your parents. Or do the vaccine and you guys will be in school with your friends. And you would be amazed how many, that's all it took. The thought of them having to be home with their parents constantly, So, not only using seriousness, but I talked to them about how the vaccine was prepared, how it wasn't the last minute thing, how I started out, how I educated myself, how I would never have them take something that would harm me, that would harm my family. And, also telling them of what I saw, of how I saw a healthy person die or an older person do fine. How, if you were to get somebody sick in your family, could you handle that? Because I've seen some young people who gave COVID to either a parent or grandparent that passed away, and it was awful. It was awful. The amount of guilt they feel because of that, because they went someplace with their friends and they didn't realize they had it, and they came back and they got sick and one of their parents died or their grandparents died. And that is one of the hardest things.
I think better days are ahead, but in order to get to those better days, we really all need to get vaccinated.
Mm-hmm. I bet you agree, Dr. Lavender.
I agree. I mean, from the beginning, from the point of, I can tell you from going to work in fear every day and coming home in fear every day of giving that virus to somebody in my household, the day we were able to get those shots, oh my God, such a sense of relief. Like I had some control back, I'm sorry. When I think about it, excuse me, when I think about that day when I got my shot, such a sense of relief, but I was even more relieved when my kids were able to get it. It's amazing when you're in the thick of things and you know that you're going to come in contact with it every day. And the fear of losing one of my children, that sense of relief, I can't explain it that day. I was just so happy to get that shot. And, there was not one person in my family that didn't get it. So, and it was because I think they saw everything we went through. We've lost one person to COVID recently, and she would have been 101 next month, my aunt, and she actually passed away from COVID. So, the biggest thing is people need to realize that, especially when it's not touching you, when you're not in the thick of things or when you're not seeing it, and maybe you're just looking at numbers on Facebook or numbers of COVID on TV. Let me tell you, when you have people that are in your family that experiencing some of the stuff we experienced, it made it really real to my family, all my brothers and sisters. I do have some nieces and some nephews that work within the hospital that are nurses back home in Turtle Mountains. And let me tell you, there's not one person that didn't go that first day as soon as they could to get the vaccine. So, not only that, but knowing how it's affected, especially our elders. We lost a lot of our speakers, and even here in Bad River, we lost 2 or 3 of some really important language speakers. Recently, we had a traditional Maday funeral that I couldn't go to for my brother, my sister's husband, because I was under quarantine. So I couldn't go to something that important. So, it affects our ability to live our lives. So the more people get vaccinated, the better we can take that control back of our lives, the better we can start living our lives without fear. I don't have as much fear now that I even have my booster. I don't have as much fear that I could die, or my worst fear is that I might not die from this, but I could be disabled. And if I develop long haulers or severe chronic fatigue, and I couldn't take care of people, I couldn't do what I love, which is medicine, and I couldn't support my family. Those were my fears. And with each shot, and as time went by, that fear lessened. I'm not as afraid to go out to the store. But let me tell you, I wear my mask and I wash my hands. And I have a 6-year-old, and he wears his mask every day. And they asked him in school, and he actually told them, my mom's a doctor, and I'm on the Bear Clan, and I'm going to wear my mask, And so these little ones, these little kids, they have less problem than anybody I know with wearing a mask or washing their hands. It's like a normal thing to him now. So, I'm sorry for the emotion, but thank you.
Thank you. Thank you. Thank you. I just like to. Wow. Everyone wants a doctor like that. So much of being well, right, is being in touch with our emotions, right? Stress is such a trigger for so many symptoms. And who wouldn't want a doctor like Adrienne Lavender to visit with about, what's ailing me, what's bothering me, and then to see her go through that kind of stress and emotion just as part of doing her job. Isn't that moving? I want to bring in Robert Pilot from our Native Roots Radio partner, who's helped us with these town halls as part of the We Can Do This Indian Country campaign. Robert's also on the tribal council of the Ho-Chunk Nation in Wisconsin. Robert, still, it's almost more difficult to listen to her today, isn't it?
Well, I relived it too. I have a radio show, and I have Dr. Stately on Mondays, and we talked about this, or I talked about this with him exactly, is that how easily we forget what 2 years ago was like with no vaccine and everything shut down. I was a high school teacher then, and we were on strike, and the governor told us to come back, and or we'd lose our health care. We came back, David, and then the next day they closed the schools down. Just forgetting that, it seems like it was a lifetime ago, and then she brought it all back, taking your clothes off and not knowing if you're spreading it with your clothes, and all our elders, because at first we remember, David, that the old people were the ones that were leaving us, and nursing homes and things like that. It was devastating in the very beginning.
Yeah, it's just it hurts to listen to her reflections, but I'm so glad that she shared those with us, and I think it's those stories, right? There's research. So we were all, and you were a teacher, Robert, and somehow we were taught that information and knowledge changes behavior, right? Give people good information, and that's going to change behavior. Well, it doesn't work that way for everybody, right? Because whose information, fake news, or call it whatever you want, right? So it's not just the head, it's got to be the heart too, right? We have to have that feeling to give us the fuel to consider something new, something different, to change our behavior, to get vaccinated, right? And Dr. Lavender just really nailed that feeling. I mean,
yeah.
Oh my gosh.
Yeah, I think too, if we're honest with ourselves and want to, protect our relatives, we have to become unselfish and get the jab. And I think a lot of our relatives out there that aren't doing it don't know this, but they're being selfish and colonized in a really strange way.
Yeah. Well, it's also easier in this day and age, right? Just to listen to the information that you want to hear, right? And maybe part of it's that kind of joke about those of us who've been married, right? And we kind of tune out each other at times because we're used to doing that. But social media has become that way too, right? The analytics feed more of what we've read and that we like, and we kind of just get the same loop and that pattern. No one is interrupting that with good information or different information, right? Because the world is complex, right? There's just not this and that, and that's the way it is, and it's not that simple. I mean, the headline today, I started the show by talking about the Washington Post newspaper headline. The headline tonight is COVID deaths highest in a year as the Omicron variant targets the unvaccinated and the elderly. And they're high because of how infectious, right, the variant is. It may not be as deadly as Delta was, but because so many more people have become infected, the death rates are just as high as Delta because of how fast it spread. So this pandemic isn't going away. And they showed in Chicago, the city of Chicago, not too far from your Ho-Chunk headquarters in Wisconsin, the city of Chicago, the death rates for unvaccinated people, 14 times higher. 14 times higher. And Black African Americans in Chicago, this is from the article on the Washington Post website, half of the infections, Black African Americans, even though they're a third of the city's population, which speaks to some of our vulnerability too, right? With some of the chronic health conditions, diabetes, and so forth. So that makes us feel more vulnerable too. And that's why this pandemic is still a serious problem. What's it look like for your people at Ho Chunk right now?
Well, Wisconsin, as you know, is a different world, and and I'm from the Twin Cities, and I'm a District 4, so I'll drive to Black River Falls, and I will stop and get gas or stop and get things, and people are not masked. It's like a different world. I was even in Stillwater, Minnesota this weekend, and it's a different world than in the Twin Cities. And I think it's a lot of things. It's misinformation. It's like, it's not going to happen to me. It'll happen to somebody else. And there's all these things going on. And right now, David, I don't know if you agree with me on this, but we're getting herd immunity, whether we like it or not, and it's killing people. And people are getting this virus so quickly and are in denial about it. And that's why it's great to have you and this show, because the truth is, you can only slant science so many ways. We were taught when we were young that science was king, and now it's a bad thing, and people are protesting it. And so Wisconsin is like I said, a different animal. And I went and talked to some Republican legislators about some issues in Madison, and none of them were masked up. And then we talked to some Democratic ones, and they were doing it all their meetings on Zoom. So there's like upside down world, different realities going on and merging. And it's difficult and it's difficult for people that probably don't spend as much time as I do listening to the news and listening to people like Dr. Stately or my wife, who was a MTM pharmacist for many years, about science. So all we can do is like put some tobacco out there, David, and pray for our relatives that they don't get, and that either they vax up and they don't get this virus, David. It's still here, and like you said, those numbers are unbelievable. And I'm at that age. If I have a heart attack, am I going to be able to get into the hospital because it's full? I mean, are people not going in there for their colonoscopies because they're too busy? And are they dying from other reasons, like you said earlier in the show?
Yeah, and the impact on the people working at the hospitals, right? I think that's also kind of a overlooked story. The TV programs do it every once in a while, right? The nurses quitting and the people doing this, and they're, all the headlines, but that headline has been there for 2 years of overworked, emotionally drained, exhausted doctors, nurses, all the physician's assistants and everybody else, right, are just up to here, if not drowning. And it's just inexplicable. Right.
Well, and like earlier was said in that recorded piece, or I should say, Kevin's wife's a teacher, and I just can't imagine one teacher's going through what they're going through right now, but plus our paras who don't even really get paid a living wage, are front lines with these kids, and it's just really heartbreaking when you start really thinking about it. And I think that piece that you put on there just before us speaking, when we were listening to that live, it brought me back, and it brought me back hard, that what 2 years ago was like.
Mm-hmm. And a lot of, as you said, a lot of teachers, right, have said, I'm done, right?
Mm-hmm.
I mean, we were underpaid before this pandemic, and now they want me to teach in-person class, and some school districts then want them also to teach virtually and to be on call, right, for the kids at home and the kids in class. I mean, who's got time to do all that, and who's got time to do it well? I mean, it's not happening well. I think we can who could do it well, right?
Right. And it's brought out all these other things too, like broadband. I mean, in small communities. I mean, it's devastating what's happening to the students. So all these, I think in the beginning, especially, it's like you really found out who is the frontline worker, or I mean, what they were calling essential workers. Who really was the essential worker?
Right. And so many essential workers who can't work at home, right, have really paid the price for this and gone largely uncompensated, right? In Minnesota, we can't figure out how to give some of the state surplus to some of those folks because of politics, right? I mean, how hard is it just to say, why isn't this unanimous? To give these folks a little bonus.
Right. Well, one people are for one party's for possible help, and the other party's against everything. I don't know what they're for. So it's been. I don't want to get too deep in politics because COVID hits everybody, but
yeah,
it's really insane.
Well, and the point is, how do we have conversations with each other again and not fall into that? I can't talk to you because of the label, and how do we start to say, well, let's start with a question, right? How are you today? How's your family? And really listen and not just say, oh, everything's fine, because usually everything isn't fine. But well, we really appreciate, Robert, you joining us, Ho-Chunk Tribal Council member, and of course all of the good work that Native Roots Radio has provided to these We Can Do This Indian Country conversations. Everyone is different, and every guest has left us with something, right? Whether it was Shannon Holsey from the Stockbridge Munsee tribe when Dr. Lavender was speaking, to your friend Chairwoman Walker of the Paiute in Nevada. Just lots of people trying to stay on top of this, and maybe it will, permanently result in a more woven, tight Indian country if we can just continue to stay vigilant. And as Dr. Christian said, our tribal leaders have been, like you and others, have been so important in that. So thank you for your leadership.
Yeah, Pini Gigi for having me on, and all that you do for our community, David. Thank you so much.
Well, thank you. We'll see you next time. Everyone, thanks so much for joining us. We can do this, Indian country. We can do this. We really can. More information, please go to wecandothis.hhs.gov. There's Native American, Alaska Native resources there. Or if you've got specific questions about the vaccines, now that the Pfizer BioNTech vaccine is eligible for children 5 and older, and perhaps in the coming weeks for children as young as 6 months who can receive the protection and safety that the vaccine can provide, not only those young people, but the families and elders and others around them and the teachers working with them. So go to vaccines.gov for more information. Again, thanks for joining us tonight. Stay safe, Indian country. Good night.
Hey,
pray through that we think of our Lord.